Thank you all for joining us on this month's Public Health Roundtable. We're going to be discussing the topic of what is public health, really understanding public health compared to healthcare, because we're often confused. So we thought that'd be a great place to start the discussion. I'm going to introduce you to the panel. We're going to take turns kind of introducing ourselves. My name is Dr. Charlotte Huntley, and I am the CEO of Dr. C.H. Huntley, LLC. We have a public health consulting firm where we target, or I should say, support large nonprofit organizations that are serving BIPOC communities. We help them essentially communicate their health information in plain language so that they can have a greater impact and empower the communities that they serve. I am joined by a phenomenal panel. Some of them you may be familiar with already. I'm going to ask them to just go around and introduce themselves. I'll start with LaShonda.
Good afternoon. My name is LaShonda Richardson. I am the founder of Emerge Public Health and Community Development. Mission is to educate, motivate, empower, restore, grow, and evolve our communities. And I am very glad to be here with my esteemed colleagues and joining on this discussion this afternoon.
Hi, everyone. My name is Andrea Lowe, and I own and operate the Social Impact Studio Consulting. My consulting firm works most specifically with health and human services, nonprofit, and government agencies. I'm working with them as they develop their strategic plans, as they're working through policy development and agenda setting, as well as program management support, as well as grant writing. I love especially working with organizations that are community-focused, community-driven, and community directed, and really working to integrate community in with their operations and systems as well.
Good afternoon, everyone. My name is Erica Horn, and I wear several hats, but today I am the founder of Akiri Consulting, and we work with nonprofits and faith-based organizations, as well as local community centers and clinics, and helping them to be able to provide resources and event plan for their communities that they serve, ensuring that they have all of the health-related needs and access to what they do need for the communities that they serve. And I think it's very fitting for today's topic when we discuss public health versus healthcare, because there's a lot of things that do merge together, but there's also a lot of things that are separate. So I'm really excited to be on this panel today with you all.
Let's dive into that. Our topic for this month's roundtable, again, is understanding public health versus healthcare. So I have a very interesting background that combines healthcare. I had spent 10 years in healthcare, infectious disease, before transitioning into public health. So I do have, from my own personal perspective, I kind of integrate that in when I explain to people who ask me, what is public health? And I get that often. I think since the pandemic, it comes up way more than it used to, which is a great opportunity. Every time someone asks, or they're usually a little bashful about it. They're trying not to ask because they think they're supposed to already know, and they don't want to, I can kind of read the body language sometimes. But I welcome the question. So my response is usually, I will compare it to healthcare and say, we are focused on population health and prevention. So I'll give the analogy of, in healthcare, your doctor, your team is looking at one individual patient at a time. So if you go into your doctor and you have diabetes, your doctor is going to look at your numbers, your trends, prescribe medication, or put together a treatment plan that suits you as an individual. On the other side of things, in public health, the doctor is looking at the population of people who have diabetes. So as an epidemiologist, I'm really concerned with this population of, we get really specific, women in the state of South Carolina within the ages of 40 to 60 with diabetes, or, by ethnic group. Black women, African-American women, Indigenous women. I mean, we can break the categories down in a number of ways, but we're looking at populations of people and what is impacting them, causing not so much the cause, but the impact of diabetes. What can we do to prevent that onset? Or what can we do to prevent the, progression, the quick progression to more serious disease? So we're looking at the populations, we're comparing. So when I explain that back and forth, and people usually go, oh, okay. So that's like my easy way of just kind of explaining public health. But then I'll go further to say it's not just disease, but anything that impacts health. And then usually the conversation goes into, oh, okay, well, what about this? And they'll think of examples and we go back and forth. But that's a way that I use my own experience, and I'll kind of kind of go in that direction. I'm really curious and anxious to hear from some of you, including in the comments. Share your thoughts on this. But LaShonda, what are your thoughts to this? How are you explaining or helping people understand public health versus healthcare?
Yeah, so very similar to what you said, just saying, explaining that the community, when I think about public health, I think about the community and how we as public health educators are, again, giving resources to the community and making sure that they have what they need as a community. So very similar to what you say. I agree wholeheartedly that we try to make sure that the populations, that we have data for the populations, and it's more community driven than individualized. So I have a very similar perspective to what you just discussed.
I always think of it as like we kind of share the same values, but the route to addressing those values can be very different. So for me, the value, like the ultimate value, is people not being sick, right? We all want to see people healthy. But I think from like a public health perspective, kind of approach or mindset, you're looking at it like you were mentioning earlier about from a prevention standpoint, like how can we help people, especially at a population level, before they even get sick. But then from a healthcare mindset, approach, framework, it's more like when they're already sick or approaching sickness, how can we keep it from being worse? How can we maybe mitigate that sickness so they're healthy again? And I feel like there's a lot of overlap between the two, and you can be within both systems at the same time, or both approaches at the same time, and addressing them as well. So I can see how it gets a little confusing too.
That's another element of it. It's not either or, it's both and. So it's not either public health or healthcare. It's important to understand the difference, but it's together that we help really, have the impact that we need to have on communities.
So I would say I have a very similar background experience as well. So I worked clinically as a medical assistant for over 6-7 years, and I worked in family medicine and emergency medicine. So for me, at first, I thought it was healthcare was how you took care of people, without realizing that, as I began to work, I noticed that we would be telling the same one person every 15 minutes, the same story of how to take care of themselves better. And I got to thinking, like, there has to be a better way. So my mind was already shifting to public health without realizing there was a field for public health. And that kind of helped me when I go to explain it to other people. And I'm given opportunities to share, ways in, through different health fairs or through different speaking engagements, whether they're at churches, but just being able to understand that it's not just the individual. And like Andrea said, it's like we want everyone to be healthy. We want every single person, regardless of, your race, your gender, what you believe, your values. It's that the goal is that all people live a healthy life. So in understanding that we want all people to be healthy, yes, the healthcare has the individualistic role of dealing with the individual one-on-one. So specifically, what are you dealing with? How can I help you? But public health is expansive. It's broad. You can attack the same issues multiple ways. I love that it's not just, only community health, but we can also tackle, environmental health. What can we do to make sure that the environment is doing well, to ensure that we're reducing risk of like asthma or pollution in the environment that's, causing, further sickness, or in transportation and emission fuels, and how all those things play a role in your health. So I think with public health, it's understanding that it's not just, what is this one person dealing with, but it's more of what are all the different factors that are affecting this individual's health. And is it just a thing within a specific community? Is it within a certain system? And how can we tackle it at different issues at different levels to ensure that everybody is completely healthy? So I use that kind of analogy. So similar, the individual has this issue, but now this is a broader issue. So like when we saw the pandemic, the whole world was dealing with it. How do we attack this issue from a high level view to make sure that everyone is still healthy? Because that was the goal. We didn't want anyone with COVID. We didn't want anyone dying. So everybody came together and trying to find a way to fix the issue. And then that's a great way to explain public health, that it's expansive, it's broad, it's not just the one, but it's the full group of people.
I don't want people to think of it as separate because it's not, but we have our individual roles. And when we need an expert to talk about public health issues, we need that person to talk about public health issues. But it's what we are able to bring to the table about the details of our communities and the different people in our communities and how environmental issues or any other types of problems or concerns can affect each of these individual members of communities differently. And that information that we as public health professionals able to provide and share and communicate to healthcare experts and professionals helps them, when they walk in the room and they see someone who fits a certain community, demographic, then they can start to understand that it's not one size fits all. The conversation may be nuanced from patient to patient depending on those needs. But without the public health information, then, we as public health professionals doing what we do help healthcare professionals do what they do better and vice versa. The pandemic really showed us a lot of that, but I still feel that because traditionally people are thinking healthcare or medical doctor with anything related to health. And this is just an opportunity to, really separate them out for a moment to really explain how we're different. But then I think that helps people to understand how well, we overlap and work together.
So I definitely agree with what you're saying as far as understanding that we all have our individual roles and how that's important to understand that, because even when you think about just healthcare, you may go to the family medicine, your general practitioner first, and if it's something that they can't handle, they'll refer you to a specialist. So understanding who those specific specialists are for whatever the issues you're dealing with is similar to even in public health. So you come to the public health professional because there's a huger issue at play within an entire community or population or region. And then they can go to, okay, this is an issue we need to tackle from a specific standpoint, a specific perspective. Let's get the, finance people involved. Let's get, transportation involved. So I think understanding that, while we are very large and there's multiple roles, everybody understands their role. But just like the MD may know, okay, I need to call on these specific specialists, public health professionals are going to know which specialists they need to call on for the specific communities. And it could be those gatekeepers to the communities who can tell you information that you won't get from, data that you may not get from someone who may not go to the doctor's office often. So being able to understand who those key players are in public health really help you as the professionals to be able to diagnose the issues in the community that you're trying to serve.
Looking at public health and healthcare, even though they're kind of separate mindsets and separate approaches and separate roles and responsibilities, that is still part of a larger system, and that they still need to be able to intertwine and work together, so that let's say you go in and you see your medical doctor, they find physical health issues, but they would be connected to the public health professionals to know how to address the maybe emotional health issues, the spiritual health issues, the other physical environment issues that need to be addressed that also contribute to someone's health. So really kind of examining this and working together to create a system where we're separate but equal and together is going to be critical also moving forward, so that we can really support our entire communities, both individually and at a population level.
I agree. I think it's just an organized effort with a common goal. I think that in everything that you all have said with the healthcare workers working with public health, it creates resource for the community on either side. So it doesn't matter if it's healthcare or public health, it's the common goal where we all want our communities and the individuals to be healthy, to be able to make informed decisions, to be able to even help other people in their families or communities. So when we're given information as public health educators, then even when individuals go into speaking with their doctors, they're more informed on maybe what questions to ask because they have a better understanding, or they have maybe been able to provided a resource where they can do, deeper research about their condition. So when they go into speak with their healthcare provider, they're more informed. So it's just an organized effort with meeting the same goal.
I'm really inspired by the fact that we were able to contribute to this discussion today. And I know that there's so many people out there that are already talking about how public health and healthcare are different, but then also can work together and be part of the same system. And I find that really hopeful for the future. Would love to see other comments from others as well on what the differences are to you, and kind of also how they can work together to support our entire health, both community and individually.
I enjoyed the conversation, and I think that it's important, and it's an important conversation to have, to just discuss how it's different, but it's also the same. It's, like I said, we all have the same common goal, and just encouraging just the community to ask questions, to continue to ask questions, because that's how we learn. That's how we are able to better the communities and just have a better understanding. And as I mentioned before, just going into your provider's office, being informed and having the questions that you need to ask to have a better understanding of your diagnoses. And when you have these resources that the public health education people provide during community events and everything like that, it just helps everyone to be better informed. So just to encourage everyone to continue to ask the questions, to continue in the conversation, and to know that we all have the common goal of being healthier and happier in our communities.
So I definitely will agree with everyone, LaShonda and Andrea. Definitely a much needed conversation, and very grateful to be able to contribute even just a small portion to it. And also thinking of moving forward, how do we continue to amplify, the voice of public health? Because for so long, people didn't know what public health was, myself included. I just thought healthcare was how you took care of people, So as we continue to amplify the voice of what public health is and continue to show people what the difference is, we're continuing to empower our communities so that they can eventually be able to be empowered to take care of their own health as well. And I think as we continue to do that for our communities, and that'll be the traditions that's, carried on for generations to come, we can definitely see a shift within, chronic diseases decreasing overall and infectious diseases. So I'm really excited for the continuation of the conversation between public health and healthcare. And I know that, with the great minds that we have here and those that are watching, excited to read what they'll continue to say. I know that we'll continue to shift in a great direction to ensure that all people really do have the opportunity to live a long, healthy life.
Thank you all. This has been great. I appreciate everyone's time. As we wrap up, I remind you that we host the Public Health Roundtable discussions the first Wednesday of every month at noon Eastern Time. And we bring a different topic and shift our panel. Sometimes we have some of our same panels will come back for a different discussion, and sometimes we have new members, but we invite you to join us each month. All right. Thank you all. Have a great day.
Have a great day.